Chances are, if you're gonna lose a tooth or thinking about replacing a tooth, you might have heard of a dental implant before. In this video, I wanna go over everything you need to know about a dental implant, from what it is, what is involved in the procedure, and what you can expect if you are gonna get one. I also wanna go over how safe they are, if they're worth any risks that you could take getting them, and if they're worth the money, because they can be pretty expensive. Now, for the majority of this video, I will be talking about replacing a single tooth with an implant. But part of the video towards the end, I'll be talking about replacing multiple teeth, so stick around. Now, what exactly is a dental implant? So I made a little drawing here to help explain it. So this is a typical tooth. You have your root and you have your tooth. So this line, imagine everything below that is your bone level. So you don't see anything below your bone. This is all anchored into your jaw. So everything you're gonna see is above here, which is your teeth. Now for a typical tooth, it involves your root of your tooth and your actual crown of your tooth, but it's all one tooth. Now a dental implant, on the other hand, is this titanium screw that goes into the bone and a crown is attached on top of it. So the anatomy of this would be the implant part, which is the titanium screw part that goes in the bone, and then there's an abutment. This abutment is what attaches the crown to the implant. So it's this middle part right here, which again, it screws into the implant and then that crown is attached on top of it. And that crown is the last part. So an implant in total is 3 specific parts: the crown, the abutment, and the titanium screw. Now, some implant systems are slightly different. Some parts have this abutment and implant piece all connected in one. So I don't want to say they're all the same, but in general, this is the gist of a dental implant. The benefits of a dental implant are that they look and feel natural. The only part that you're going to see again is that crown. And the cool thing with dental implants is they preserve the jawbone, because let's say you get this tooth taken out and there's nothing to replace it. Well, now that bone will start to recede and you'll start to lose some of that bone here. But an implant will actually integrate with that bone and you'll prevent bone loss. You'll actually maintain that bone there. Now, last point I want to make, there are other materials than titanium. The most common material for an implant is titanium, but sometimes people are allergic or they don't want any metal in their body. So for example, there's also a zirconium implant, which is a ceramic that is used instead of this titanium. Now, how exactly does an implant work? Like, what is the start process from start to finish? Well, the first visit will probably be a consultation. So unless you're in severe pain, like you have an abscess or something and you need to get your tooth out right away, this first visit is very simple. You'll talk with the doctor and they'll talk to you about your options. So if you have one tooth, for example, that's broken and you need to get it out, but you want to learn about a replacement option, this visit they'll talk to you about your options. Now, depending on the case, you might have a tooth that needs to come out, or you might have had a tooth taken out before and you've had a missing space for a long time and you decide now's the time I get this spot replaced. So there's a few different scenarios. So let's say option 1, you have to get this tooth taken out. So the dentist will take that tooth out, and then sometimes they can place an implant the same day as they take the tooth out. So they'll take this tooth out and then they can place an implant that same day to replace that tooth. It doesn't mean they're going to put that crown on, but that implant that's mimicking that root can be placed the same day. Now, this is a per case basis. Sometimes we cannot place an implant the same day as a tooth is taken out. So in that case, we'll take the tooth out and put bone grafting in there. A bone graft is basically a placeholder. So for example, in my office, we use an allograft, which is cadaver bone that is donated to be used for medical purposes. So we will put this allograft or this bone graft material in that socket, and then over time, your own bone will start to eat up that spot and then remineralize that bone, and then eventually it will turn into your own native bone. So let's say we do option 1. We take that tooth out and then we put that bone graft in that spot. We will want that to heal for at least 3 months, and then we can go back and then put that implant in there. But if we take that tooth out and then put that implant the same day, then we can skip those first 3 months. Now, if you are placing that implant that same day as taking that tooth out, you'll probably still need some bone grafting as well, but I can let you and your dentist talk about that. So that's the first stage, which is the surgery. And another scenario, which I forgot to mention, is you haven't had a tooth for a long time. You had a tooth taken out and it's been so long and you haven't had any replacement. In that case, you can go straight into the implant placement. Now, in all these scenarios, I'm basically assuming that you have enough healthy bone. And I'm going to get into other scenarios where you don't have enough bone. But once that implant is placed into that bone, we want that implant to integrate with your bone. You cannot just put a crown on it the same day because you're going to start to chew on that, and eventually that implant will fail because it's not integrated with the bone yet and it's not ready to take those forces of chewing. So you want that implant again to integrate for about 3 months, and then you can put that crown on. So from start to finish, taking that tooth out and replacing it with that crown, it could take about 6 months. Now that is like best case scenario if we're doing it the traditional way. The traditional way is if we take that tooth out, put bone grafting, wait 3 months, put the implant, wait 3 months, and then put that crown on it. Sometimes it needs to take a little bit longer depending on your health history. For example, if you have diabetes or if you have some gum disease, it could take longer for that to heal. Or if you had like a really big infection with this tooth and that infection ate away a lot of your bone. And instead of doing a normal small bone grafting, you need to do a really big bone grafting. And that could take a lot longer to heal. So that 6-month time period is kind of best case scenario if we're doing it the traditional way. It could also take you roughly 3 months if you take that tooth out and put the implant the same day. Because if you do the implant the same day, you're cutting out those first 3 months. Now, what are the benefits of doing a dental implant versus something else? Well, a dental implant is the best long-term solution we have to replace a missing tooth. Implants are often cited of having a success rate of 95% or higher after 10 years. So some sources say they'll be like 98, 99% successful. Some are closer to 95%. So that means after 10 years, there's at least a 95% chance this implant is still going to be successful. Now you might ask, what if I want it for the rest of my life? How come there's no studies showing that? Well, most studies in dentistry don't go past 10 years because the good studies take a lot of money to fund. And in dentistry, when they see something's been successful for 10 years, they say it's successful. There's not really any more points putting money into this. So most studies don't go that long. Now, but this obviously depends on other factors, like how well you take care of it. Are you going to be biting into beer bottles and other stuff with this implant, or are you going to be eating normal food? Are you going to be brushing and cleaning your teeth like normal, or are you just going to say, I'm never going to need to brush my teeth again? Now, sometimes people also ask me about a dental bridge. A dental bridge is basically, instead of doing a dental implant to replace a missing tooth, a bridge is when you crown the tooth behind a missing space and you crown the tooth in front of a missing space. And then those two crowns are connected with another crown in the middle. And that crown in the middle is obviously a fake tooth, but that is a dental bridge. The benefits of an implant over a bridge is you don't have to crown your neighboring teeth. With the bridge, if you have two healthy teeth surrounding it, now you have to crown those teeth and basically remove unnecessary tooth structure. And the other problem is that bridge is relying on two neighboring teeth. So let's say something happens to that tooth in front of it. Let's say you get an infection with that tooth, or even a cavity, like a small cavity. To fix that cavity, you have to replace that whole bridge. So that could be a lot more expensive down the road. Initially, an implant might be more expensive, but down the road, in the long run, the bridge could end up costing you more. Also, a dental implant is easier to clean. Like I said, it's its own individual tooth. So you can floss and brush around it just like normal. Versus a bridge, it's all connected. So you have to clean underneath it by either threading that floss underneath or using a water flosser or something underneath that bridge. Side note, I will say anybody that gets a dental implant, I will recommend using a water flosser along with flossing normally around that implant. And the reason is, as good as implants are, they're not a natural tooth. And your gum tissue around a dental implant is never going to be the same as it is around a natural tooth. And it's really good to flush that area out around an implant with a water flosser because more bacteria can build up around that implant. And if you flush it out with that water flosser, you're gonna limit those bacteria and basically preserve having that implant as long as possible. Now, what are the common concerns with dental implants? The most common question or concern I have is pain. Is it going to be painful? Like, you're screwing something into my jaw, doctor. Like, how painful is that going to be? Well, surprisingly, most patients recover very well from dental implants. And the procedure itself is not painful because you will be numb. Now, some people want to be asleep for a procedure like that. Some people want to be awake. It doesn't really make a difference. If you want to be asleep, you might have to go to a specific surgeon or a specialty where they can do that type of anesthesia for you. But in general, the hardest part is going to be keeping your mouth open for the procedure. Another big concern I hear is the cost. And why is it such a big investment? Well, part of the reason is the materials cost so much because you're paying for this crown, you're paying for this abutment, you're paying for this implant, and then also it's multiple procedures. So there's a lot of doctor time, there's a lot of staff time, during this procedure, so it's a pretty involved procedure. But the benefit is you get to replace your tooth, and it's the best replacement we have. There's a really big benefit to keeping all your teeth, or keeping as many teeth as you can. For example, once you lose one tooth and don't replace it, then your neighboring teeth will start to drift. So over the years, it's never just one tooth. You start relying on your other teeth more. Your teeth around that missing space will start to drift. And as those teeth drift, they can get more compromised, and then you can lose more teeth in the future. Then what happens is you start relying on other teeth, and those teeth might crack or break or have other issues, and it's kind of like a domino effect. Losing one tooth could mean losing many other teeth in the future. I'm not trying to be dramatic or anything like that. I'm just trying to be realistic. But again, the choice is yours. If you don't want to make that investment, if you want to leave it alone or do something else, it's entirely your decision. Our job is just to make you make an informed decision. So that way, whatever you decide, at least you have the knowledge to make a proper decision. Now, the other cons with the dental implant is, one, the healthier you are, the healthier the implant. So if you have diabetes or severe gum disease, or if you're a smoker, then there's a higher chance that that implant could fail. It also depends on the surgeon themselves. Yes, I'm gonna say it, a lot of people don't like saying it, but it can be technique sensitive. And some doctors can perform the surgery better than others. And the way that an implant is done could make a difference in how long it lasts. For example, even with replacing the crown of the implant itself could be perfect, but putting the crown on the implant, sometimes that crown is cemented on, where it's basically glued on, or sometimes it's screwed on, where there's a hole in the top of that crown, it's basically screwed in, and then that hole is patched up later. I prefer to do the screwed in route. And part of the reason is because when you do it cemented, when you cement that crown on, if any of that cement is sticking around after, if it's not all cleaned away, then it can cause a lot of bone loss, because that cement does not react well with around that implant and around that bone, because your bone will sense it's a foreign object around here, and it'll start to create a lot of inflammation, and then you can start to get some bone loss around that implant. That's called peri-implantitis. Now look, I'm not trying to scare you or anything like that, and this is a very rare thing that happens, and most dentists that do, whether screw retain or cement retain, do a great job. And most surgeons also that place implants do a very good job. But these are things that you should know before going into these procedures. And it's also a good reason to go to someone that you trust. If there's someone that you trust, but they're a little bit more expensive, versus you're going to the shady guy around the corner who's doing it for half the price, but hey, at least it's cheap, I would probably go to the person that you trust. Now that being said, who is a good candidate for dental implants? Well, most people are gonna be good candidates. Ideally, you'll have healthy gums, sufficient bone quality and bone volume, and also you're a non-smoker, and preferably don't drink that much alcohol either. The alcohol is not as big, unless it's combined with smoking, then it can be really bad. Also, as long as your diabetes is under control, then it's not really an issue. Now, some common questions I get are, one, can you place implants and restore multiple teeth with them? Yes. For example, there's a procedure called an all-on-X. This is where all of your missing teeth are replaced with implants. And the way to do that is you don't place an implant in every single spot to replace every single tooth individually. What you do is you place 4 to 6 implants in the top jaw or the bottom jaw, whichever arch you're replacing. And then you're screwing in this appliance that replaces all your missing teeth. So that way those 4 to 6 implants are replacing like 14 teeth in just one arch. Implants can also be used for dentures, but not like traditional dentures, but something called snap-on dentures, where instead of a traditional denture where it's kind of moving around and it never really fits very well, having implants means you can snap that denture in. It's basically these buttons that attach from those implants to that denture. And instead of moving around as much, that snap or those buttons will basically hold that denture in place. You can also do an implant bridge. So like I was talking about a bridge before, but instead of anchoring it to 2 teeth, if you're missing like, let's say 3 teeth in one spot, you can do 1 implant in the front, 1 implant in the back, and connect those 2 implants with 3 crowns. And that way you don't have to do a 3rd implant right in the middle. I know I talked a lot about the disadvantages of bridges and having to clean underneath them, but it doesn't mean I don't like bridges. I just want you to know the cons of bridges, just like I talked about the cons or the disadvantages of implants. And there's a lot of different scenarios where you could replace multiple teeth with a single implant. And it's probably best to talk about this with your dentist, because a lot of times dentists can get creative and they can kind of talk about your different options and see what you're open to. Another question I get is, what if you don't have enough bone? Well, I will say in most situations, there are ways to manage this, but sometimes you'll need a more complicated bone grafting. Sometimes you'll have to go to a specialist for a surgery if you really want to get enough volume of bone, but sometimes you just can't get an implant. Sometimes you just have to settle, for example, a dental bridge. But if you really want an implant, then you can still ask about it to your dentist and they can go over your options. All in all, implants are a game changer and they have made a lot of strides in recent years, and they can go a long way in replacing your missing teeth and really restoring your smile. So if you're nervous or scared about getting one, definitely talk to your dentist about it, and just know it's a very routine procedure nowadays. And again, even the recovery period after is pretty routine now. Anyways, thank you guys for watching. I hope you liked that video. If you haven't already, hit that thumbs up button and subscribe to my channel below. I will see you in the next video. Did you know that your tongue could be the key to breathing better while sleeping, and even preventing sleep apnea or fixing sleep apnea and other sleeping conditions? That's because the position of your tongue when you're resting, especially when you're lying back and sleeping, could be the difference between snoring and waking up at night versus sleeping soundly and having